Hi, my name is Jensen. I'm going to do the week 6 discussion for communication topic. The window is open nearby, so if you hear the cars driving by or crying, it's my dog. He's next to me. Anyway, I really liked the article, What If You're a Bully? Not only in the aspect of healthcare, but in everyday life. Sometimes we don't have that introspection on how our words and our actions are affecting others, and it could be something super simple, like, rolling your eyes or something like that, or it could be like very blatantly disrespectful and rude, of like degrading somebody. But I really like the article, not only in the aspect of healthcare, but additionally, like, it's something that I've personally been working on. Not because I feel that I'm a bully, but sometimes I do feel like I can come off abrasive, and it's not necessarily my intent, but it can be perceived that way, and not just at work, but at home as well. Sometimes, you get stressed out, overwhelmed, worked up over small things. You got a lot going on, nursing school and work and capstone and all this stuff going on, and sometimes, you just get short, and it's just because you have a lot going on, and you don't necessarily mean to do it. And one thing through working with my family and my significant other of this issue is something that was also mentioned in that ANA article was having someone around you or a nurse saying, hey, like, you're coming off as this, and like pointing it out in the moment. And it is very difficult to do. And then also being perceptive to that feedback. It's something very difficult to do as somebody being like, hey, you're being rude to me. Because sometimes it isn't perceived well by the opposite party, and it's something that my family and I are trying to work on together. Like, we have the same issue. It's just an issue with communication and maybe meaning something one way and it coming out another. And so I really like that, not only in the aspect of healthcare, but like implementing that into everyday life. So I thought that was really cool. The assertive communication guidelines, if you looked at them, are quite literally just super therapeutic communication for anyone that you're having like issues with. I can re-pull it up, but mostly it's like instead of you statements, I statements, being like assertive in a way of, like I had mentioned earlier, like, you're being rude and disrespectful to me. This is how it's coming off. You said this and it made me, I feel like this because you did this. So, and just like kind of being a little, I don't want to say firm, but like strong in what you're saying, not to necessarily hurt the other person, but like looking at them, sorry, someone yelled outside, looking at them and having good body language and not necessarily being like closed off to them, which I really liked. So I think that's all I had to say on those. To kind of go over some of the questions for my capstone, I've actually been noticing this. There is a tech on the unit that I'm on that kind of can insert themselves into situations that aren't really in their scope of practice, and makes the nurses probably feel, I would imagine, like she's not feeling like I can do my job correctly, right? Like, that's how the nurses feel. And then she messes up on a few of her CNA tasks or tech tasks, and it makes them like a little more aggressive and kind of rude of like, but this person gets mad at me for, not having my discharge orders completely filled out yet, but like she hasn't done vitals in 2 hours. Like, it's just kind of something that can be easily avoided. And I feel like everyone on the unit kind of pushes this girl off to the side because of that reasoning. And it's just something that could be avoided with a simple conversation of like, hey, when you do this kind of stuff, I know that it's probably out of the best interest of like you and the patient, but it makes me feel poorly, and it doesn't make me want to communicate with you, and it doesn't make me want to work with you and work things out with you and do nice things for you. And then we're missing out on rounding and vitals and things like that because it's not necessarily in my scope or in my nurse's scope of responsibility, but it is in the scope of the entire healthcare team. Like, it just needs to get done regardless. So maybe there's kind of, because of that kind of like irritation with one another, you start to build resentment and then not communicate, and then that can affect the patient, and we can miss out on things, especially in postpartum. We can miss out on a lot. A vital sign on a baby is extremely important. And if something is wrong, even like temperature, blood sugar, anything like that, it needs to be identified immediately, and not having that open communication can definitely hinder that. So something I've noticed was that this can really, I feel like, has impacted me as a new grad and someone going through clinicals, was because like you kind of, in clinicals, you show up to the unit, sometimes the nurses do or do not know that you're there, and it can just be really awkward. You're just such an odd person out. And I even noticed this during my capstone. You're such an odd person out, and no one really knows the dynamic with you and what you can do and what you can't do, especially during clinical. And sometimes they're just mean. And I feel like something that I've really had to adopt, working in healthcare for a while, and working hand in hand with a lot of providers in my job, especially during procedures and things like that, is sometimes they're stressed out, just like I get stressed out, and they come off a little blunt, and it is your responsibility to say something. It doesn't have to be in front of the patient, because I don't necessarily think that's appropriate, but to say, you know, hey, you may not have meant it that way, but it was kind of rude. Like, or I'm sorry. And sometimes like readdressing it gives them the opportunity to kind of rethink of what they've said. But I don't know, I feel like it's a really great article, covers it a lot, especially in the aspect of health like care, but kind of just has people for us to be more reflective on what we're doing, and more reflective of what we are saying and what our actions are doing and how that affects somebody else. So thank you.